the sleep must be having some impact on the physical and mental health.
Every part of the sleep cycle is important. It has its own function. Now, completion of both NREM and REM and then the cycles will impact the overall body.
And what is more important, either the quantity or the quality of sleep?
Now, sleep efficiency doesn't only depend on the quantity or the duration. It depends a lot more on the quality.
When we were young and studying and there was lack of time little bit, we used to take those power nap.
So this power nap helps us as a repair function. Second is it helps us to restore our mental stress.
So how does sleep affect the mental health or mental well-being?
All of a sudden, once in a while, you have a sleep impact, you don't sleep well. That's not going to affect much, but definitely the next day you will feel those effects.
Any meditation or mind calming exercises we do to improve the sleep quality?
These exercises can be done when lying down.
Namaste. Welcome to Arogya Mitra podcast, your trusted companion in healthcare insights and expert advice. Today, we are discussing something which is very essential for our overall health but often overlooked. Join me, your host, Dr. Varsha, and our expert guest for today, Dr. Gururaj Udachankar, a consultant chest physician and sleep medicine expert, as we explore the impact of sleep on overall health, various sleep disorders, and the tips to improve your sleep quality. Welcome, Dr. Gururaj.
Hello, ma'am. Hello, everyone.
Yeah, and let's get started about the topic which haunts many.
Yes.
So the basics first, the sleep must be having some impact on the physical and mental health. So what is the impact of sleep on these
Yes, ma'am.
parameters?
See, when the person sleeps, he goes into these stages. So initially, there is a slight wake period, and once that stage is over, he goes into a lighter stage of sleep. That's the N1 stage, where the patient or the person is arousable with any stimulus. Then the N2 and then the N3. Now the N3 has got little different waves in the, EEG waves, but N3 is the deepest form of sleep. And once that is taken place, once that is completed, then the patient enters into REM sleep. Now, every part of the sleep cycle is important. It has its own function. Now, completion of both NREM and REM and then the cycles will impact the overall body. Now, if I consider like there are specific hormones which are released inside the body and they give us the definition of biological clock.
Okay.
What we call it as circadian rhythm. Now, body is actually very fantastic, man. It actually has its own clock. We just have to see that we are in coincidence with the or coherence with the biology of the body. Now, as the age, as the day advances, there is one important hormone which is secreted, that is melatonin.
Okay.
That's the sleep hormone. So, as the sun sets, the secretion of melatonin starts and it increases as the night progresses and it comes down as the day starts.
Okay.
So, this gives the body that the night has taken place, we need to sleep. That maintains the biological clock. Now, if that is disturbed because of the sleep pattern, then the entire body system gets affected.
Okay.
Second important is the growth hormone. That growth hormone is released during certain stages of the sleep, which actually functions as a repair and growth of the body. So the repair of the body, whatever is taking place, that takes place during this secretion of growth hormone. So the entire day's work, the body has to be rested. So whatever wear and tear takes place inside our body, the repair mechanism starts with the help of growth hormone. So the growth hormone helps in repairing the whatever damage that has taken place, micro level damages. Then third important is the cortisol level. Now this is very important. As we know, it's a stress hormone. Yes. It prepares our body to see the stress and get prepared for it. We call it as fight and flight hormone. So the level of cortisol is reduced as the sun sets down, and during the night the cortisol level is at the lowest, and at the early morning the cortisol level starts increasing so that we get prepared for the day work. So this helps us to maintain the immunity. Basically, the immune function regulation takes place with the cortisol secretion. So once the sleep is affected, this immune regulation doesn't take place and there is an imbalance with the immune system. That is the most important. What we have, the cortisol levels, which directly affect the sleep, and then the body's immune function. Now, another important hormone is the insulin. Now, that helps us to metabolize and maintain the blood glucose level, and that is secreted and to maintain the sugar level during night episodes.
Okay.
So that secretion gets affected, and that overall affects the metabolism if the sleep is disturbed, and the blood glucose levels are start getting fluctuated. One more important hormone, which we have, hormones for hunger and satiety. Now, they are important hormones which tell us that during the sleep we should not feel hungry.
That's true.
So, see, if we sleep on a hungry stomach, we don't get sleep. So, once we are with the dinner, is everything is over. So, these hormones tell us that the satiety is over. I mean, the other part of that hunger center, the stomach is full, so you sleep down. So the I mean, whatever that stimulus to eat anything, that is not there. So that goes down. So we sleep. Once the sleep is disturbed, the satiety and hunger hormones are misbalanced. And again, if we stay late night, we start getting hungry.
Midnight
Midnight,
cravings.
yeah. And the craving is so bad that it is always for a higher calorie foods,
That's true.
and that's for a carb. So they feel that we are hungry and we need to improve our glucose levels. So immediate something to gratify. So that's a high calorie level gratification which we always have. So that is affected. So if more of high calorie intake we take, then again the weight gain is there. Again the metabolism is affected. And the last hormone is the thyroid stimulating hormone. So that also helps in the metabolic part, which is there at the level of N3 and REM sleep. Now, these hormones play an important role in maintaining the overall metabolism during the sleep. And we don't need that metabolism because we have to conserve our energy. We are not doing any work.
That's true.
So we don't need energy. So the metabolism has to be at the lowest level. So all these are functioning according to the circadian rhythm. The moment the sleep pattern is disturbed, these secretions are again disturbed, the entire immune system is affected. So these hormones are important and secreted at the specific stages of sleep. So once we skip or once we reduce the duration of sleep also, the balance is gone and we are prone for so many effects of sleep deprivation.
So sleep deprivation can have a very serious consequences when we talk about diseases like diabetes, diseases like thyroid metabolism problems, and also there is a problem in the repair system of the.
Yes, ma'am.
So that gives us the insight into how important it is to have a sleep and have all stages of sleep, and that cycle is so important. And so many times our elders have told us that there is a specific time to sleep, have your biological clock, and
Yes.
this. So wonderful, it is so good
So
to get that
that's
insight.
always there, ma'am. Actually, the concept now has changed that we always tell our patients, don't put an alarm to get up, put an
Hmm.
alarm to sleep.
Okay.
You complete your cycle, you wake up. See, you told that our grandparents used to tell us early to bed, early to rise. They never had alarm clocks, right?
That's
So
true.
they used to wake up at the specific time. No matter what happens, at that time, they used to wake up. Why? Because they used to sleep at a proper time. The cycles were completed. Once the cycle is completed, we don't oversleep. See, you have not seen anybody oversleeping unless they are they are sleep deprived, or there are some kind of sedatives or some kind of alcohol intake or
That's
some
true.
kind of sleeping pills. Nobody oversleeps. They have to get up. The body wakes up at that particular time. The cycles are complete. The body wakes. That's the simple mechanism. The problem comes is we don't sleep at the right time. So we have to wake up, right? So when we don't start the sleep, the cycles are completed at a later stage. We put an
That's
alarm, and unfortunately, if the alarm goes at a particular cycle, for example, we always get up in a REM sleep.
Mm-hmm.
We don't get up at NREM sleep.
Mm.
Once the REM sleep is completed, the body wakes up.
Mm.
If we put an alarm at an NREM sleep,
Mm.
then our sleep is disturbed.
Mm.
Then we don't complete the cycle. We feel that the sleep is not complete. We don't feel fresh. We feel that we need to sleep a little bit more. And then once the cycles are disrupted, that we will discuss how the effect of sleep deprivation takes place. So once the REM sleep is completed, the body wakes up. So simple rule of 7.
Okay.
7 hours of sleep, 7 days a week.
Okay.
That's it. Sometimes you have seen that, especially with all our, the profession demands that we almost both of us in the same profession, and the demand for sleep deprivation, doing all those duties at an emergency level, definitely disrupts our sleep. So, but now it is almost said that sleeping early at the exact time will never make you the need for an alarm clock. You get up at a particular time, you're fresh. So 7 hours of sleep, 7 days a week. There is nothing called as binge sleeping. Work for 5 days, get
That's
deprived,
true. Hmm.
and I'll sleep for Saturdays and Sundays. That will not help. The body needs rest, so 7 hours of sleep is more than enough. So there's a concept that I'll sleep Saturday and Sundays, and I'll cover up the entire quota of that sleep whichever I have lost in that previous week. That is not going to happen.
That is
That's a
not going to have a positive impact
yes,
on your health, and you
yes,
will face some problems. But 7 hours of sleep, 7 days a week is doable, I feel.
yeah, yeah, yeah.
So nice. So another thing which is discussed a lot nowadays is the how much is the ideal sleep, and what is more important, either the quantity or the quality of sleep.
Yeah. So this we are discussing about the sleep efficiency, what we overall describe it as. Now, sleep efficiency doesn't only depend on the quantity or the duration. It depends a lot more on the quality. Now, if the patient has got a wonderful sleep, we call it as a sleep efficient person. Now, what is sleep efficiency? It is simple. The duration of sleep, actual sleep, divided by the number of hours spent on the bed into 100.
Okay.
That's sleep efficiency.
Mm-hmm.
So they say more than 85% the sleep efficiency is good enough. Now, if the patient has to have a proper sleep or a good sleep, there are a lot of factors which take place, which we have to consider. One is the duration where he starts sleeping, that is called as sleep latency. He gets into the bed and he sleeps, goes into the sleep. So that is the sleep latency. The sleep latency is very important. They say it is less than 20 minutes. So ideally, once we go to the bed and sleep with all the environment and everything comfortable, we have to take hardly 20 minutes, not more than that, to go and enter the stages of sleep,
Okay.
to fall asleep. That's what we
Hmm.
say.
Hmm.
Longer the sleep latency, then we coming into insomnia. That is difficulty to get into the sleep. Now, if that is less, second is to go and complete the stages of the sleep. That is what complete the 5 or 7 cycles of the sleep and then get up.
Hmm.
So if that is completed, irrespective of the duration, your sleep is good. So some people need 6 hours sleep, some need 8 hours sleep. It is not defined duration for everybody.
Mm-hmm.
Now, as age advances, the sleep duration also comes down. The infants, toddlers, school going children, they need a better and more duration of sleep, because REM sleep helps to know, I mean, it helps to recover the neurological status, it helps to improve the intelligence and memory. So
And
they need,
growth also
yes,
for
growth
them.
also, for growth and repair.
Hmm.
So they need a longer duration of sleep. And old age people, their sleep pattern is reduced, they need a lesser time of sleep. So they somewhere around 6 to 6, less than 6 hours. So overall, 7 to 8 hours of sleep is more than sufficient for an adult person. And yes, of course, all 7 days.
Yes. So here we are talking about quality more than quantity, because it is important that all the cycles are completed and we get the advantage of all those
Yes,
things.
yes, yes, ma'am.
Doctor, can you tell us what are the different stages of sleep and how each one is important?
Okay. Ma'am, we have two definitions. One is sleep defined physiologically. It's a temporary state of unconsciousness, irreversible state, which comes in between the cycle of wake. So, wakefulness and sleep, they alternate. And behaviorally, the sleep is characterized by four things. One, there is decreased response to the external stimuli. Body posture is important, so especially for human beings, we lie down and sleep. Third is our motor activity is almost absent, and the last one is it is reversible. So this is the definition of sleep. And another definition is sleep is a luxury and it's a privileged asset. So we
That's
know
true.
somebody who doesn't sleep well, the difficulty with what they undergo. Now, sleep is having two stages, ma'am. One is called the non-REM sleep, that is rapid eye movement sleep. So the first is NREM sleep, that is non-rapid eye movement sleep, and the next stage is rapid eye movement sleep. So these are the two important stages, and it's a cycle basically, a 90-minute cycle. So the sleep stages in the non-REM sleep are divided into N1, N2, and N3. And in non-REM sleep, the N3 stage is a deepest form of sleep. This is the most important part of the sleep, where most of the restorative function of the body takes place, repair takes place, and most of that resting mechanism, and which gives the actual advantage of sleep to the body. Then the REM sleep, what we call as REM sleep, it is the next cycle of the sleep. So this comes after the NREM sleep, and this is for a short time. It's also called as paradoxical sleep. I mean, it's a deep form of sleep, but there are a lot of activities which are going on, like
Okay.
twitching of the eye, movement of the eye. So that's why it is called as REM sleep. But it is the deepest form of sleep. So the both NREM and REM stage is equal to almost 90 minutes.
Okay.
So in each sleep cycle or in each sleep duration, we expect somewhere around 5 to 7 cycles to complete, so that the patient's entire sleep is beneficial, plus the quality of sleep is improved, and the sleep duration also is covered. So these are the different forms, and I mean the stages of the sleep.
So to get the complete advantage of sleep, both the cycle should complete.
Yes. So
Only.
basically what happens, as you see, the duration of sleep is different for different age groups. We do not have a strict duration for anybody. It is a range. Now, for infants and babies, they sleep almost for 18 hours a day.
That's true.
And they have the major part is the REM sleep, which is the maximum duration in their sleep stages. Then, as the age advances, for school going children, it is around 10 to 11 hours. And for adults, it is almost around 7 to 8 hours. And as at the extreme ages, for older people, it still reduces. So it's somewhere around 6 hours. But the golden rule is almost approximately 7 hours of sleep for any individual, adult individual, is more than sufficient to complete the entire 90 minutes of that one cycle. So 5 to 7 cycles are completed.
So ideally 5 to 7 cycle of both the stages is important
Yes,
for to say that the person has got a sound sleep.
sound sleep. Yeah.
So as we are talking about it, so much is happening when we are just sleeping. So we have been talking about the physical impact of sleep. It sometimes also happens that when we are doing that binge sleeping, or we are sleep deprived, we also get a sort of mood swings and irritation. So how does sleep affect the mental health or mental well-being?
Yeah. See, once the sleep is deprived, whether it is an acute deprivation of the sleep or it's a chronic sleep deprivation. Now, sleep deprivation for an acute phase, like for example, all of a sudden, once in a while, you have a sleep impact, you don't sleep well, that's not going to affect much, but definitely the next day you will feel those effects, what we call as short term effects. Now, if the patient is deprived for a shorter time of sleep deprivation, there are short term effects. The most important is there is irritability, there is one is anxiety, because one is there are a lot of things which takes place during the sleep which will calm our mind, which will calm our brain. With so much of exertional overthinking and thinking to the entire day's stress, the brain needs rest. So the rest is in the form of that NREM and REM sleep, especially with that REM sleep. And there is where there is a memory consolidation, there is short term recall and long term recall memory which is getting affected. And then there is lot of emotional calmness which takes place once we complete the sleep. Once the sleep is deprived, this short term effects of mood swings, irritability, we lose the capacity of decision making, concentration is not there. Sometimes we have seen don't sleep properly the previous night, the next day our entire work schedule is disturbed, we don't feel like doing that work, so easy fatigability takes place, our concentration time reduces, our mental calculation method and abilities come down, and our patience is gone. We get more of irritable, temper tantrum starts, and problem solving, that quality comes down with the short term effects. Now coming to the long term effects of sleep deprivation, one is the toxins which are released during the sleep, they have to be detoxified, and those toxins directly affect the brain. Okay, so that detoxification mechanism takes place during the sleep. Now if the phase of detoxification is not there, is it's skipped or it is reduced, then the brain starts accumulating toxins. That's
Okay.
called neurotoxins.
Mm-hmm.
So with that, the effect of all those neurodegenerative degeneration changes and neurodegenerative disorder starts coming now. The most important what we have seen or the research data says that Alzheimer's is very common in patients who are chronically sleep deprived.
Okay.
So these are the most important. Second is the memory is very short, and they don't have that proper memory to recall those things, whatever. So it's
Retention is lesser.
yes. So that's actually sad part of the whatever lifestyle is we are following. And second thing, this is actually a bad news for some students. We have seen that the overnight study is there, and the next day they feel like they want to give the exams.
Mm-hmm.
And you have seen the topper, or somebody who gets a good mark, sleeps well, the next day he gets good marks. So it's like that, वो सो के भी इतना अच्छा marks मिलता है. The entire night I studied, I didn't get good marks, because the memory restoration, the total recall of whatever you have studied during the day is actually preserved. It is again consolidated during the sleep, and that is how the recall memory is better once the sleep is completed. So that's why we always tell, there is no point, or research says that ki overnight study is not going to help. Study during the day hours and sleep, rest for the brain, so that whatever you have studied is imbibed inside, that is consolidated, and that the recall process takes place once you are fresh. So these are what happens once the patient is chronically sleep deprived. So with the mood swings, neurological, and of course with other systems also, we have seen that one, with the metabolic effect, the patient, if he is chronically sleep deprived, his metabolism is affected. Second is blood glucose levels are affected, so he's more prone for obesity, is more prone for diabetic mellitus, and all the thyroid problems. Next important is the cardiovascular. Patients are the patients are prone for all these cardiovascular events, because the cortisol levels are dysregulated. There is a more of a stress which increases the levels of atherosclerosis inside the blood vessels, that leads to stroke, myocardial infarction, and all the cardiovascular events, including the sudden heart attack, whatever we see. So these are the effects of individual organs. So not only the mood swings, but also the physiological of every system is affected once the patient is deprived for the sleep for a very long duration.
So many times it happens that nowadays, especially it is happening that what you said about the heart attacks. The the person is apparently very healthy, and the sudden heart attacks happen. The reason can be this into the sleep
Yes,
and the
definitely.
lifestyle, because we always look for the short term reasons,
Correct.
but we never saw what was his lifestyle.
Yes.
So youth today is going more and more to binge sleeping. They are not sleeping, they are sleeping just 3 to 4 hours in the night. And Short term, it can affect your relationship. You can have a fight with your girlfriend
Definitely.
or
Yes,
your
yes.
friend, and long term, you academic performance can come down, and long term you can have such grave effects.
Yes.
So that sleep is the secret ingredient, I feel.
And one more thing is, N2 stage is called a beauty sleep.
Okay.
So the more the depth of N2, the longer the duration of N2, the more person becomes beautiful. So the N2 sleep has to be completed.
Yeah.
So it's called more of beauty sleep.
Yeah, that is what we girls always say. I'll call myself girl.
Yeah,
Ki,
definitely, ma'am.
I have to complete my beauty sleep, so I have to concentrate on the N2.
Yes, yes. So you have to complete the N2 so that you want to become more beautiful.
Yeah.
And weight gain also. I mean, you don't sleep properly, the weight gain is very, very drastic, and it is too fast. So it leads to obesity, and then further it reduces the sleep, which will then lead into obstructive sleep apnea or obesity hyperventilation syndrome. So all these are effects of obesity, and that affects sleep. So sleep affecting obesity, and then obesity again affecting sleep. So it's a vicious cycle.
Yes.
Properly don't sleep, you get you gain weight, you don't sleep well, so the cycle continues.
That's true. So sleep is so much beyond that what we take it.
Yes, ma'am.
So there is also this, especially in the youth, and also we have also done that when we were young and studying, and there was lack of time little bit. We used to take those power naps.
Yes,
So
ma'am.
how does that help, or it is just the myth?
Yeah, see, you must have seen in lot of videos where, you know, I mean, in the Western countries, there is a special, accommodation being made, or a time slot given during the office hours. They are made to take rest for 20-25 minutes, then come back to work. Now, the word itself says it's a power. So it's a nap. Nap means it's not sleep. It's a short duration of sleep. It should be less than 20 minutes, not more than 20-25 minutes. It has got various names, ma'am. One is the power nap, which we commonly use. It is also called as coffee nap. I mean, have a lunch, sip, take a sip of coffee, then go for a sleep for 20 minutes, not more than that. So this power nap helps us as a repair function. Second is, it helps us to restore our mental stress. That is what important. It is more likely that the patient's mental stress is reduced
In the
with
middle
a,
of the day.
yes, in the middle of the day. So it's a nap for 20 minutes, not more than that. It is also called as NASA nap. Now, NASA scientists have also told that sleeping for 20 minutes in between, whenever you get time, that also helps us to restore our mental stress and calm us down, so that our concentration increases, our mood is little better, and second is our recall memory also increases. So the concentration span also is better and improved with this power nap. But of course, yes, not more than 20 minutes.
So if at all you are feeling fatigue, and you want to concentrate but you are not getting it right, then it is good idea to take a power nap.
Definitely, yes. It's definitely good with the working schedule and all. So ideally, if you have time, or if your slot is there during your working schedule, you have a break of half an hour or something, or anywhere with a cozy environment, 20 minutes of nap definitely helps us. But definitely not more than that. We are supposed to reach the lighter stages of sleep and come back.
Okay.
We don't want to enter the N1, N2, N3 and then REM. No. If we start entering that stage of sleep, and if we complete more than 30 minutes, we get into a drowsy feeling.
Yeah, the cycle is not
Yes.
completed maybe.
And we get into something called as sleep inertia. Like we get up, but we don't feel fresh. We feel like we are still dozing. We want to sleep. So that's because we are entering those stages of sleep, which will have to get completed, right? So once the nap is over, of that power nap is over of 20 minutes, we come back, we are fresh, we have got better mood and with fresh thing, so we are energetic. But if we enter the stages, our next stages, then we get drowsy. So that is very important, time duration, and that is why we can put an alarm here in a power nap. 20 minutes, put an alarm, you enter the light stage and come back.
Revitalize.
Yes, revitalize.
Another issue which many of the middle-aged people experience is something snoring, and it is something which is experienced by many but accepted by very few.
Yes.
And the person who is at more problem or who is irritated is the spouse or the partner. So is snoring indication that there is some underlying problem?
Not always, ma'am. See, snoring is quite common in some people. Less than 40% they snore, and we tend to snore also, especially when we are too tired, exhausted. And that's because the muscles are relaxed. Now the muscles are relaxed everywhere, especially in the pharynx and all, and there is a partial obstruction to the airway because of the relaxed muscles. And when the air flows through that partial obstruction, the palate moves, the soft palate moves, then we get that sound. So that is in a deeper stage, snoring is quite common. But if snoring has a pattern, now when snoring has to be considered pathological, now see, as you told, snoring is never a complaint given by the patient. It's always the family members and the spouse especially. It is so bad that they start sleeping in a different room and the sleep is disturbed. So the entire family members is disturbed. The moment they said, you have snored, nobody accepts it. So we have seen so many times the patient's relatives come up with a recording. This is how he snores. This is how it is so bad. That actually helps us to understand the apneic phase of the sleep apnea. Now snoring, if it is very bad, loud, in a certain stages like waxing and weaning, it starts increasing and then it starts reducing, and for a gap of 10 seconds or more, the person is almost not breathing at all.
Yeah,
that's
and
the
you
apneic
get that
phase. Yes.
sound.
Yeah. And sometimes it is so frequent and sometimes it is so longer that the spouse suddenly gets up and starts waking up whether the patient is still breathing or no.
That's true.
And it's a very panicky state when that
In
happens.
the middle of the night.
Yeah, in the middle of the night. So he literally, the patient is woken up from the sleep and he says, are you there? Then yes. Then that cycle. So that cycle is very bad. That is apnea cycle. So snoring as a waxing and weaning. Second is with the episode of apnea, which can be 10 seconds, sometimes it can be 20 or 30 seconds also. That creates problem for the person as well as the spouse. Now, because of the sound, the spouse doesn't sleep, but the effect of snoring for that individual is so bad that sometimes it is missed at an early stage. And snoring has to be considered as a warning sign with one, if the patient is very obese. Second, the sounds are so loud that the entire family members are disturbed. Third, the snoring pattern is like reducing and increasing with a gap of, say, not breathing at all for 10 seconds or more. That is very problematic. These are the warning signs which we have to consider when only snoring is being complained of. And this snoring is always from the spouse.
Right.
So it's not acceptable by the patient, but this, whatever description is done, this is a classical description of sleep apnea. Sometimes snoring can be the only symptom where the patient has got this kind of sleep apnea syndromes.
Okay. So are there any tests from which we can get to know whether it is pathological or normal?
Yeah. See, the gold standard for this is what we call it as sleep study. Now, sleep study is a method of analysis of sleep, and that of course happen during the night and during the sleep itself. So we have different levels of sleep study, 1, 2, 3 and 4. And level 1, level 2 studies are little higher studies which we have to assess the oculography, EMG, EEG activity. All those are like a finer details and more details of what
so
we
the
want.
admission is required for
Yes.
the sleep study?
For the sleep study, level 1, this is a hospital admission, because there's also a video recording which is being done that helps us to know what is the position. Are there any abnormal movements during the sleep? Is there anything going on during the sleep? So that is all has to be video recorded. So level 1, ideally it's a hospital based study. Level 2 can be done at home. The only difference between level 1 and 2, there is no video recording in level 2. But level 3 is a home based sleep study. We can do it at home. It's a simple study where We have to differentiate these kind of sleep disordered breathing, or what we have called as sleep apnea. So this sleep apnea can be obstructive sleep apnea, where there is an obstruction to the airways, difficulty to breathe, and central sleep apnea, where the response to that stimulus, or the centers which will give you the breathing pattern during the sleep, they are affected. So to differentiate between that, we do level 3 study at home. So it's level 3 is a simple home based sleep study which we can do. And ideally, why we prefer home? Because see, we know that sleep is more of a psychological.
That's true.
The moment our pillow is changed, we don't get sleep.
Hmm.
We have to sleep on the right side of the bed only. The
So-
moment we shift to the left side, we don't want. See, there's a fight that goes on everywhere.
Fight
Yeah.
on the side, on the AC temperature,
Yes.
all
So
those things.
this is my pillow, this
Hmm.
is my blanket. See, I don't get sleep. That is very important. That's why home sleep studies are always preferred.
They're more
Because
accurate.
yeah, and more accurate. Plus, the patient is in a comfortable environment.
Mm-hmm.
See, imagine somebody trying to assess your sleep, and you are attached with so much of instruments. The patient is so uncomfortable. He's so aware of those things that he doesn't get sleep.
That's
So to make him comfortable, especially at home, so you get a best place is home. You get the best sleep at your
That's
place.
true.
So you don't get sleep anywhere else. So to make that comfortable, we always give an option. Home-based sleep study is very convenient and very easy, and definitely it is not so expensive. Can be done by a technician comes home and attaches the instrument. So the entire sleep study is recorded. The next day we are ready with the recordings, and then we analyze the sleep study recording. We analyze how much is the respiratory rate. We analyze how much is the oxygen levels in the blood. We analyze how much is the heart rate. We analyze what is the respiratory effort. We also analyze what is the level of snoring, the percentage of snoring, and we also analyze how much is the breathing pattern. So with all the combined assessment, we get a score. Based on the score, we tell the level of severity, if it is mild, moderate, and severe. And based on the report of sleep study and the symptoms, we advise some device for the patient.
Oh, the treatment is also available for this.
Yes, yes. So once the sleep study report is available, based on the patient's symptoms and the sleep severity index, we advise CPAP. That's a continuous positive airway pressure. Now, this is a simple device which we tell the patient to apply it on the face when he's asleep at night. And this will, what it does is, it prevents the collapsibility of the airways, so that the airways are kept patent, open, the snoring comes down, the breathing is improved, oxygenation improved, and third is the efficiency and the quality of sleep also is improved. So it is little difficult because some patients tend to get claustrophobic with that
With the
CPAP device,
mask-like thing.
but it definitely works. We have seen patients where they are reluctant to use it in the beginning. They say, we don't want to use this. This is what I can sleep better. I'm not okay. Everything is fine. But once they start using it, it is out of 10 patients, 9 patients come and tell us that we want to use it, we want to continue using it, we are feeling the best sleep ever, and we have slept well like a baby. So that's how the response comes once the patient starts using the CPAP device.
This is wonderful that the even the solution is available, and it is so simple.
Yeah, and we also have that nasal mask, especially for the only snorers. They snore. There is a simple device called as NEPAP, where it is applied in the nostrils during the sleep, and the snoring is reduced.
Introduce. So your spouse will also get a better
Yeah,
sleep.
better sleep. So you always have to work for the family, and this
Exactly.
is the best way.
Quality and quantity
Quality
both.
and quantity both.
Yeah.
And most of the times after CPAP therapy, we have seen couples doing well.
The relationship
Yeah,
improves.
the relationship improves.
Slow. So sleep medicine for better
Better
relationship.
relationship. Yeah, yeah.
That's wonderful. Also, that we see a lot of times that in youth, this insomnia is more, or there are the sleep hygiene is not followed. So, what is your recommendation for following this sleep hygiene techniques?
Yeah. Now sleep hygiene is something where there are set of daily practices, and which we have to follow so that our overall sleep efficiency increases. It's a wonderful science. It's a wonderful treatment which starts at a very early stage. I mean, there are a lot of things which we have to consider. One is we have to fix a continuous, consistent routine. I told you, like, we have to sleep at that same time. So the consistent of sleeping at the right time, same time, all 7 days is important. Second is we need to see that our environment of sleep is very important. That matters. The bed should be comfortable. We are supposed to sleep in a dark room. No bright lights. No
No,
strong music.
no screens.
No screen times. Of course, that I'll discuss that one. So that environment has to be cozy. And third thing is you need to do some things prior to you go to sleep. Now, one is you're not supposed to have a heavy meal before you go to sleep.
Okay.
I mean, they say 2 hours prior, have your dinner early, and gap of almost 1.5 to 2 hours before you lie down. So that will prevent lot of acidity problems which we tend to face because of heavy meals. So light meals, no caffeine. Some say caffeine should be not consumed after 6.
Okay.
So it has to be there before 6. No late evening caffeine.
Mm-hmm.
No hot water or no any stimulants basically.
So
You
no hot water baths and all.
Hot water bath is okay,
Mm-hmm.
but no anything ingestion or consumption
Okay.
of any beverage which is used as a stimulant. Now
Hmm.
basically coffee, tea is used as a stimulant. We
Mm-hmm.
need to get fresh when we wake up.
Mm-hmm.
That's where we have our tea and coffee. But having tea and coffee at sleeping time will in fact make you more better energetic and the sleep is gone. So no caffeine stimulants before you go to sleep. No heavy exercise. That's what they say. Light exercise, some kind of stretching exercises or some kind of yoga therapy also helps, but no vigorous or strenuous exercises at a late evening stage.
But doesn't physical exercise tire us up and helps us in sleeping?
Yeah, but the intensity and duration and the timing is important.
Okay.
Now if somebody is sleeping well, they tend to get up early and they have an early morning schedule of exercise.
Mm-hmm.
These people do better with their sleep quality and efficiency.
Okay.
For people who don't and who exercise very late night, they say it is good enough, but it should not be vigorous. Now, high intensity vigorous exercises, just nearer to your sleep time, will have increase your adrenaline. There is an adrenaline rush. Your heart rate increases. The sympathetic activity is more. So your sleep is disturbed. Light exercise is definitely advisable, but no heavy exercises.
So no gymming at
No
night.
gymming. That doesn't serve the purpose of your weight loss,
Mm-hmm.
because that in turn affects the
This biological
yes,
cycle.
yes. So the sleep is affected. That is after 8 p.m. So see, sometimes we can't fix the time of sleeping, but they say 8 p.m. Like after
Mm.
8 p.m. you're not supposed to touch any kind of screens, like no mobiles, no laptops. Don't watch television, especially if it is very disturbing. No having any kind of negative atmosphere or negative news or something like that. You're not supposed to see that, because in turn it gets affects the sleep. You're not supposed to fight before you sleep. That is very
Okay.
important. So you need to not you're not supposed to be hungry. So you should be little stomach full. So hunger will kill your sleep. So you can't sleep on empty stomach. That is also very important. And the moment you lie down, suppose there's a 20 minutes of thing which you have to wait. So don't fidget in the bed, don't try to roll on, and don't try to struggle that you are not getting sleep. There are some sleeping exercises which we can do so that you get early sleep. If you're doing physical activity, definitely your sleep latency come down.
Mm-hmm.
I mean, the sleep efficiency increases and the sleep latency also comes down
You fall asleep early.
early and faster if
Mm-hmm.
you do a better exercise. So that is how we have to maintain those practices. So this is how we have to plan our schedule, so that prior to sleep all this can be done. Now there are some things which you are supposed to do. Now these are the things which we are not supposed to do. Now they tell that having warm water or warm milk will give you better sleep. It should
Okay.
not be hot milk. It should be
Achha, just
little warm.
warm.
It should be
Okay.
little warm,
Mm-hmm.
because milk, some certain kind of milk and milk products will increase the melatonin secretion, will give you a better sleep.
Mm-hmm.
So that is how they say that having warm milk, but not coffee.
Mm-hmm.
So not hot milk, but warm milk
So
will
don't add
definitely.
anything which will
Yes,
wake you up.
yes, yes.
Mm.
And sometimes you can have a hot shower before you sleep, you get a better sleep once you have those hot shower. That also can be done as a practice to see that you have a better sleep. And that's how,
That is the
all these
sleep hygiene.
practices have to be practiced every day. It's not that one time practice, you need to practice it every
Consistency.
day. Yeah, consistency has to be
So
there.
what I'm seeing is doing basically what our grandfathers and grandmothers used to do
Yeah,
before that we entered into this digital era and everything
I
started
mean, they
going
were
on.
the best people, it's always told that a saaf pot and a mast zhoop is a
That's true.
blessed person.
Yeah,
So if a person has a regular bowel, person has a regular sleep, is a blessed man.
that's
And
true.
you don't get so many diseases also. It's always
And
been
you
true.
cannot buy it anywhere.
Yes, yes, you definitely cannot buy it.
You have to earn it
Yes, you have to
by the sleep hygiene
hygiene.
and the
Yes,
practices
if
you
you
follow
yeah, yeah,
consistently.
if you follow those, then somewhere your sleep cycle can be regularized.
Mhm.
But the older you get, and if your sleep is disturbed and this timetable is continues, then this hygiene may not work at a later stage, because your sleep is again, it is fixed, it is now generalized, and it is going on since so many years. All of a sudden you can't sleep at that time. So you need to practice it at a very early stage.
Start
Start
young.
early. Yeah.
Are there any meditation or mind calming exercises we do to improve the sleep quality?
Yeah. So this exercises can be done when lying down. You need not sit there, and that during the sleep latency, you can do some exercises so that your mind is calm. And second is, you get a better sleep and an early sleep. The best and the basic exercise is deep breathing. Okay, slow and deep. That is important. So 10 breaths. That's what deep breathing exercises will be helpful. The next important is a rule of 4, 7, and 8.
Okay.
Counts of 4, inhale through the nose. Count of 7, you hold your breath. And count of 8, you exhale through the mouth or the nose. So this technique will help you calm your mind and improve your sleep quality. So sleep of for 4, 7, and 8 rule. Now how to count? 1001. So 1000 is 1 second.
Okay.
So you need not take a watch and count. So
Because it will
so
disturb again.
1001,
Hmm.
1002, 3, and 4.
Hmm.
Take through the nose. 7 counts, hold it, and 8 counts, you then exhale it. So up to 8 counts. That's a 4, 7, 8 technique what we have. The next is, we have something called as, we should be proud about it, that the Sleep Foundation has accepted this as one of the therapy, and this contribution is from the India, that is Yoga Nidra. Yoga Nidra is now a proven practice, and they have accepted that Yoga Nidra is a form of, yogic meditation and a form of yoga which will help improve the sleep. Now, the Sleep Foundation has taken Yoga Nidra as one of the most important relaxation techniques to improve the sleep quality, and this can be done in lying down. Now, Yoga Nidra is nothing but Shavasana.
Yeah,
So
exactly.
it's a state where your body is at rest, asleep. Now, body is asleep and mind is still aware and awake of the environment. So this phase will help you to get a better sleep. So all these exercises are simple exercises, can be done on the bed, lying down, just before you try to sleep.
And that will improve the
Improve the
quality of it.
quality of sleep.
Wonderful. So everything is manageable with little bit of consistency and discipline.
Yeah.
But sometimes it so happens that our work demands us to sleep at a not the actual time. So abnormal sleeping patterns some people have, maybe because of the work shifts, or sometimes people have to travel. So how they can manage their sleep?
Yeah. Now, being in a health profession, we know that sometimes we tend to get emergencies and our sleep is disturbed, and we need to work late nights or shifts or emergency duties, or night rounds, night ICU duties. Now, unfortunately, there is no replacement for a good night's sleep. But definitely, we cannot compromise our profession. If our profession demands, then definitely we need to take some precautions and care so that our sleeping pattern is regularized. Now, shift is somewhere there is a definition of shift where late night shift, early shift, anything after 6 p.m. and up to 7 a.m. is a shift work. Well, that's what they define. Now, how is the shift work? It depends on individual profession, and the techniques which we use and help us to have a regular sleep depends on one, the number of night shifts the person has, the regularity of night shifts, and third is whether it is for a single night shift or a complete week there is night shift. Now, some tips what they say so that your sleep is regularized. Now, somebody has got a one night in a week where they have to do a shift. So the next day, what are they supposed to do? One is there are two things what they can do. They can go home, get a shower, get fresh, and sleep in the morning for few hours, then have lunch, and then again sleep for a longer time, and then complete the sleep cycle. So this can be done if the person is having once in a while night shifts. Suppose the patient has got a regular night shifts but not continuous, then in those persons what we advise is never skip your earlier night sleep.
A
Have
day
a
prior.
Yeah, a day prior, have a complete sleep. Don't miss that sleep. That sleep is very important. Second is, you see that if your night shift is regular enough, then you need to get accustomed with that sleeping pattern. So don't stay late the previous night. Don't have anything which will disturb the sleep the previous night. The previous night sleep is very important to see that the next day sleep is taken care. We always have that night duty off,
Yeah,
that is to cover up the sleep whatever is being disturbed. So most of the times there is a off once we do
there
the
is
night.
alternate days
Yes,
pattern.
yes. So during the daytime what they can have is they can have a short sleeps during the day, so that their night sleep also is not affected. So imagine you cannot sleep for 24 hours. Somebody has done a night duty, okay, he has not slept previously. The next day the person sleeps for few hours in the morning, few hours in the afternoon, and then the night sleep is as normal as possible. But if you sleep for overtime during the day, you cannot cover up or you cannot have a night sleep the next day. So what you're supposed to do is during the day it's very difficult to sleep because the entire day is everybody is working. Now what you are there is lot of light, there is lot of noise. So see that your room is dark, you have no noise in the exterior, and don't take any stimulants during that time. No caffeine or any beverages. Have light meal, don't overeat and have a large meal. You can have naps, short naps, and short meals. Then the morning sleep can be a little shorter, afternoon sleep can be a little longer, so that the sleep pattern at night is again taken over. So that can be done. If it is regular night, then the same pattern has to be continued through the week's time. How much ever the patient tries to cope up is difficult. You cannot replace
So you
the
have
night
to
sleep.
reverse the cycle,
Yes,
sort of.
and that has to be regularized. And the patient has got night shifts, that also regularity. You cannot say I won't sleep the entire day, I'll sleep directly at the night. It's difficult. The body will not cope up with that stress.
That's true. So here the key is again reversing the cycle and
And regularizing it.
regularizing it.
That is most important.
Exactly. Thank you, Dr. Gururaj, for joining us and sharing the valuable tips so that we can improve not only our sleep quality but also our overall health.
It was indeed a pleasure discussing the most important aspect of any human, lifespan. We always say that we sleep one third of our lifespan, right? And sleep is a wonderful thing which relaxes, restores, repairs so much of in the body, and we need to concentrate on that. Everybody deserves a good night's sleep, not only the person, including the family members. So regular exercise and a good sleep definitely makes you healthy and better.
So, thank you, viewers, for joining us for the important session on sleep at Arogya Mitra podcast. Remember, small changes will can make a big difference. Thank you.